Welcome everybody. So we're back talking about shoulder pain. This is part 2 in our The Pain series. So we did part 1 where we were talking about the traumatic types of injuries and causes, and this one we're going to go more into the degenerative types of shoulder issues. So again, this is part 2, and we know it's part 2 because I'm over here now.
Yes.
And Sean's over there.
It was like magic.
Yes. So we are the FitHealth Pros, and I am Dr. Kevin.
I'm Coach Sean.
And so I want to go ahead and remind everybody about how the shoulder works, kind of the definition. So physical discomfort of the shoulder where it's coming from the joint itself or the muscles, ligaments, and the tendons. And all of those things will support the shoulder. So let's go ahead and get into the types of injuries in the degenerative type of shoulder pain.
Okay, so as we go into these types of injuries, I'm going to start with bursitis. Now, that is when there is a swollen bursa sac within the joint. You can get that through repetitive use, you can get that through falls. So sometimes it can be a little bit more of an impact versus degenerative, but oftentimes you'll see it as more of a degenerative injury. Rheumatoid arthritis, which is an immune attack on the joints, where the immune system actually starts attacking the joints and giving you that deep achiness and sometimes shooting pain within the joints. There can be referred pain, which initially resides within an organ such as the gallbladder or the liver, and then presents itself in the shoulder. That's a little harder to diagnose at times, so that can be a little tricky. And any of these type of injuries, I want to kind of reiterate what we talked about in the first video. We're not here to diagnose. We are just here to give you information to help educate you a little bit. If you do have a shoulder injury, please see a specialist.
Yes.
And as I was talking about that referred pain, only really a specialist would be able to give you what's going on, that it's not starting in the shoulder in the first place, but it's starting in one of the organs. Also the heart attack, if you were to have a heart attack, you got that radiating pain coming down that left arm. Osteoarthritis, which is the other type of arthritis, which is more degenerative in terms of the cartilage breaking down over time. That cartilage kind of breaks down between the bones, and these bones start rubbing. So you can just imagine, and some of you don't have to imagine because unfortunately you have the osteoarthritis. Mm-hmm. Harsh reality at times. Tendonitis, which where the tendons in the rotator cuff get inflamed. Again, that can be both over time or due to a direct fall. Mm-hmm. Bone spurs, which can be pretty tricky and very painful. It's small pieces of bone that rub the rotator cuff. Definitely need to make sure to get somebody to help you with those if that's the case, because that can lead to tendonitis over time, or it could actually go one step worse, possibly many steps worse, with a rotator cuff tear. The last one I want to kind of talk about is lymphedema. This is where there's a buildup of the lymph fluid in the arm tissue after breast cancer surgery. Sometimes during those surgeries, some of the lymph nodes and the lymph channels are removed, so the body doesn't know where to drain this lymph fluid. So it ends up building up and creates a swelling in the arm that goes up into the shoulder. So oftentimes with breast cancer surgery, though, they will actually talk to you about that as a possible side effect.
Okay, real good. So as you can see, if you did watch our part 1, these types of injuries are definitely different. So if you're coming over from part 1 and you're more of the kind of weekend warrior person that's more physical, if you know somebody that has these types of symptoms, have them watch this and make sure that they understand that there is help and that it is within the realm of certain physicians to handle this, and they can get better. A lot of people don't know. They just have this pain and they think, oh, well, I'm taking a medication for that. And really, it's all encompassing because, again, that shoulder is complex. There's a lot of little bitty joints, little bitty muscles, ligaments, and tendons, and that allows it to have great movement. But again, there's more susceptibility to issues, and even the issues that are farther out but can still affect that shoulder. So we are covering that wider variety in this one. So let's go into some of the other causes, and that's going to be inflammation. So you have inflammatory processes, whether it's a quick trauma or if it's a degenerative state. So that's usually accompanies both types. Immune attack, so where the body's attacking itself, again from that rheumatoid arthritis, that's another one that you want to seek the appropriate physician for that. Degeneration, so what's that degeneration type of pain? So osteoarthritis, tendonitis, the bone spurs, all of the things that are, I'm not going to say all degeneration is repetitive, but most of the time it is from repetitive use over time. Sometimes that degeneration can be a little hereditary, but we're going to say for most people look for it in that repetitive motion. So if you can start thinking about that and preparing, you can kind of push that off down the road, because
focus on posture, focus on the way that your form is on whatever you're doing, whether it be playing sports or throwing a ball or something like that. Make sure that you're doing it correctly.
Right. A lot of us, especially if we're working from home, we're sitting there. Hopefully you're getting up, you're taking breaks, your movements of all the joints. Just know that if you're doing the same type of job over and over, I'm thinking of a cash register at the grocery store, or if you're lifting something and moving it the same way, those are the type of things that are going to cause degeneration, not just in the shoulder, but all over. Some of the other causes are going to be surgery to the other body parts, so not just the shoulder, but other areas as well. And then you are compensating for that weakness, or from your rehabilitation after that surgery. So those are the causes. Now let's go ahead and go into the effects.
So speaking of effects, we're talking about kind of how these how this pain presents itself. It could be a burning, such as in the bursitis, that inflammation within the bursa sac. It could be an achiness, like osteoarthritis, which can also be a shooting pain, where you would think that it would be more of an impingement, but it's actually coming from the osteoarthritis itself, and kind of, that rubbing. It could be a radiating pain, tendonitis, arthritis, the heart attack, like I had mentioned earlier. You could get a general stiffness. I have plenty of that from the dislocation and a separation during my rugby days, like I had talked about last video. As I age, I get much more stiffness now as the years pass from injuries that happened years ago. I'm not going to say how many, but it was years ago.
Years.
So, and it can also present itself as a type of swelling, which can create a limited mobility. Now, oftentimes when you're dealing with shoulder injuries, that limited mobility will be the first sign that something's wrong and that you need to go get some help.
Absolutely. All right, so let's go into some of the types of therapies that we can do or that you may have at a therapist's office. So these types are, again, this degenerative type of pain may come exactly from the area or be coming from a different area. So keep that in mind and make sure that you're disclosing that to your therapist as well. So physical therapy is one of those. And sometimes you'll actually have to ask if there's a specialist, if you have something like rheumatoid or lymphedema or this is therapy post-heart attack or post-surgery. So make sure that you're looking for that specialist and you're getting the right type of therapy there. Aquatic therapy is very popular because it's going to take the pressure off the joints by putting you in an anti-gravitational environment, and so that's really good. You can do lots of different exercises and resistance training there. As a chiropractor, chiropractic's going to skew toward the structural type of misalignments, but also by lining you up, it's going to allow those nerves that affect the muscles and the joints to kind of kick back in, to restart. A lot of times there's a disconnect between neurology and that tissue. So, you know, keep that in mind there too. So within the chiropractic practice, we do physical rehab as well. So exercises, stretching. There's some modality therapies where the technician's going to work on you or those surrounding areas, possibly with ultrasound, microcurrent, muscle stim. Things like cold laser have been shown to decrease that inflammation in the arthritises and in the tendinitises. There's a modality called pressure wave, so radial pressure wave, that's been shown to improve the inflammation and the healing of those soft tissue ligaments, tendons, and muscles. So that I have had done, and that was after my injury, and it took me to actually have the therapy done to now recommend that to patients, and hands down.
It's something I'm actually looking forward to having done myself since Kevin recommended to me.
Yeah. And so, again, it's not a diagnosis and it's not a treatment recommendation for you, but it's something that you can go ahead and start looking into, because we want to kind of spread that word. I think a lot of people have never heard of pressure wave therapy or shock wave, they have called it in Europe. Radial pulse wave is another word. So I want to tell you all about those things. You're always going to get some ice, possibly some heat in the therapeutic setting as well. So I know when I had physical therapy and when we work on patients here, at the end of the treatment, we're usually putting some modality on with ice over top of that, and we may recommend doing some moist heat before or after to contrast that, to improve that blood flow, to increase the healing. At home, same thing. Hot shower, some ice packs, light range of motion, movements, and stabilization. You may want to prop your arm up on a pillow so you can use the mouse just with the forearm and the wrist, and you can take the pressure off. I think that there's anti-inflammatory nutrition, which we didn't go into last video as much, and I had thought about it while we were talking. So we had talked about anti-inflammatory nutrition in our other videos in the back pain series, I believe.
Yes.
And things like turmeric and quercetin. For shoulders, I've heard of glucosamine and MSM. Chondroitin has worked with some people. Now, I've been in practice 23 years, and I think the glucosamine, chondroitin, MSM combo has been around about the same amount of time. And it used to be so expensive, and people who used it, it really worked. And I think that they kind of psychology affected their belief system because they were laying out a bunch of money. Right. It's really inexpensive now. Even Costco has a great blend. And here's my recommendation. And this isn't a recommendation or a diagnosis and a treatment, but if you try glucosamine, it's over the counter, so I'm not treating anybody. Take it for a month, and you should notice something. Yeah. And if you don't, then don't take it. Because it has to be loaded for a month. So don't think the first 2 days or the first week you're going to feel something, but after a month, if you're feeling more mobility, we give it to our dog as well. So that's for the arthritis, and he can move around.
My father uses it, and it really helps him with his arthritis.
So that's the natural type of thing. Pain meds and muscle relaxers, you're going to get a prescription for that.
Right.
So probably have to go to a DO, a doctor of osteopath, or your orthopedist is going to order that, or your primary care. The PTs and the chiros can't do that. So we try to do everything pretty conservative at first, and we know the modalities that we use are going to reduce that inflammation, those TENS units, those pressure waves, ice and heat. And for 90% of the people, we can avoid those narcotic medications and those anti-inflammatories. Wanted to go into the bone spur a little bit as well.
Sure.
It's like, what do you do with that bone spur? How do we fix that? Well, I always tell people, you get the MRI, you have a bone spur. Unfortunately, it is a hard,
It's a bone.
it's calcium that builds up on that bone, and it can tick away at that ligament or tendon into the groove of the bicep or one of the rotator cuff muscles. And so what I do from a structural standpoint is we're going to look at that and address the triad problem. So the neck, the upper back, and the shoulder. We're going to take the scapula and we're going to try to identify if there's any rotation factor. If there's rotation of the scapula, that's going to affect that AC joint, which we talked about last time.
Yeah.
And it can balance the body enough to where now the shoulder may roll in or roll out where it's appropriate, because the wear and tear usually happens in a dysfunction type of posture, okay, or an overuse or a guarded or compensatory kind of thing going on. So you may have neck pain, or you picked something up and that compensation has caused that shoulder to go through range of motion, and then that bone spur got created. So if we can put it in its best position,
Then it's not going to be
it
rubbing.
may not rub on there. And so you asked me before, what happens if it keeps rubbing?
Right.
Well, surgery, and they go ahead and sand that off.
They got to get in there. You know, we're trying. Yeah, that's the medical term.
Yes.
And it's still hard to spell.
It is. Let's try to spell it.
There's some Z's, some S's.
Right. So that's kind of what the bone spur aspect. But I wanted to point that out because, again, we're talking about degenerative shoulder issues that could be caused by compensations, not just a direct trauma. And you get to these points like, oh my gosh, my shoulder's just killing me. It's radiating all over. I can't lift it up. What is it? Well, you know, again, that's why we're bringing this to you, because it could be a complex issues. It could be one or all of those things. So I hope you like that.
Man. So this is Dr. Kevin Fox. He's one of the FitHealth Pros. I don't know if you've seen him on any of these videos, but he's around.
Yes.
And he gives good information like that. So thanks for stopping by on this part 2 of shoulder pain in our the pain series for the FitHealth Pros. Please like this if you got something out of it. I'm sure you did. And subscribe to get even more of these videos. We've got a bunch of them. We got a bunch more coming. Today we talked about different types of degenerative shoulder issues, some causes, some effects, some possible therapies. Dr. Fox went a little deeper this time. It wasn't just about defining these today. You actually got some bonus material too, which was fantastic. Thanks, Dr. Fox.
You are welcome.
So once again, we are the FitHealth Pros. I am Coach Sean.
And I'm Dr. Kevin.
And thanks for coming along for the ride. We'd love to have you along for more videos like I was saying before.
Absolutely. Smash that subscribe button.
Smash!
And we'll see you later.
Like us. Really, really like us. Thanks, guys.